Let me quickly see who's there and who's not. So don't forget what I told you yesterday. Tomorrow we have, no, next week, Thursday, you have the exam, okay? Tamara, are you here? The quiz, sorry. Tamara Montserrat? No? Emilio Marroquin?
Here.
Gustavo?
Here.
Adam? Ana
Here.
Sofia Villanueva?
Here.
Anna, is you that wrote me about question 9 in WhatsApp?
No.
No?
No.
I got a message, somebody asking about the question number 9 about some kind of review activity. No, it should be somebody else. Santiago Emilio Bichara.
Here.
Okay.
Here.
Valentina Cecia.
Here.
Here.
Okay. Oliver Leonella.
Here.
Carlos Trevino. Okay. Ana Pau.
Here.
Okay. Rafael Luis.
Here.
Here, teacher.
Okay. Isabella Trussell. She's missing. Andrea, are you here?
Here.
Okay. Sochu.
Here.
It was Ana Sofia Romano who wrote me, I think. Is that true? Ana Sofia, are you here? No, she's not. So I think it was her anyway. So yeah, now I have it. Guillermo's here, right? Yeah, Guillermo.
Yep, I'm here.
Okay, Ivan and Vanessa.
Here.
Okay, perfect.
Here.
Okay, let's start, guys. We're going to continue and possibly finish the urinary system. We need to finish because the next system, which will be nervous system, I believe, is a little bit more complex. Urinary system is one of the more simple systems, except for the hormonal part. But fortunate for you, you don't have to know the details about this. Yeah, I've seen you, Carlos. You don't have an absence. And so we're going to see quickly I'm going to quickly show you what we have done yesterday with some models. So we have identified the different parts, okay? You see here the renal artery. You have these tools. You can click on it in Canvas. I told you already that biodigital human and biozygote body, or what's the other one called? These are the 3D models you can use for every system, organ system, and it's very nice because you can really see where they're located. It's way better than just watching on an image, because here you also see that this goes a little bit here. This is a girl, and you see here that the ureters, they're a little bit banded to the back. And why would that be? What's here? So
The reproductive system.
Sorry? Yeah, exactly. The reproductive system is here. So that's why this you cannot see that in an image. It looks like this, but if you look like this, you can see that it goes a little bit to the back, and that's normal because here you have the uterus, and you couldn't see that if the image was just like this. It just seems that it goes down, but it's not true. Okay, so that's really nice about these images. Here you also have another image, which is the nephron. Okay, we have seen that yesterday, how that works. This is like where the filtration happens. This is the capsule of Bowman, and here you see how the fluid goes through the loop of Henle, and everything is reabsorbed. What is useful and what is waste basically stays in the tube and goes here to the collecting duct to then be joined in the ureter to fill the bladder. Okay. This is the video about the hormonal system, but I have to do another thing first. In fact, today, it's more, you know what we're going to do, because I think you do that a lot with Tutoreo. And I would like you to participate in the chat a little bit. So what you have to do is like this kind of mood meter. We're going to do that in my group, okay? It's going to be very brief, but I would like you to write me in the chat in Spanish if you want. Yeah, please, in Spanish. you select the emotion that I'm going to show you. It's not ruler, but it's very similar as ruler. You're going to select the emotion that you have on the chart, and then you're going to write down why you think you have that emotion. So that's a little bit what we have to do. And I would like you to click on the screen to select the emotion, okay? You do that with a star or something, you know how that works in Zoom, and you're gonna select this emotion, and basically you're gonna write two things. You're gonna write your emotion, and then after everybody wrote their emotion, you're gonna see on the chart where the most emotions are located. And then you have to write down, what do you think is the reason that the whole group is tendency to these emotions, okay? Is that clear? Just with one phrase. It doesn't have to be very complex, but it's an exercise that we have to do. Here you have it. So you can do anotaciones on the screen. Voy a cambiar tantito a español porque eso es en español. Entonces, pueden usar una estrellita, por favor, y yo creo que ustedes tienen derecho de hacer anotaciones en la pantalla, ¿sí? ¿Sí saben cómo hacerlo?
Sí.
Por ejemplo, tú puedes decir, me siento deprimido, pones la estrellita y ya, ¿ok? A ver, déjame quitarla porque yo no estoy deprimido. ¿Cómo le quito? Sí. Ok. Y para mí es un poquito complicado porque sí hablo español y todo, pero no conozco el verdadero significado de cada emoción. Hay emociones que yo no sé exactamente qué, como dichoso, no sé qué es. Okay. No ve, I don't see your stars, guys. Put it on the screen, please. Okay, Alan.
I'm thinking. 1 second.
Okay. And then please put in the chat why you feel that emotion. And then when everybody puts their star on the emotion graph, then write down why do you think that the whole group is having these kind of emotions, okay?
In English or Spanish?
In Spanish, please.
Okay.
Ay, Emilio, you're exhausted. That's bad. Bueno, it's almost Friday. It's not bad, but it's
And we write why we feel this way,
yeah.
or
So
okay.
you write in the chat why you feel, for example, exhausto, you individually, and then in a second one you write one, why do you feel exhausto, and then second you write down why the whole group has low energy. Why do you think? Because there is a clear tendency that everybody has low energy, like the big majority is here on the middle of between agrado and not agrado, you know, like on the border, and with low energy. Why is that? Is there too much homework? Is the future looking bleak? It's taking too long? I don't know. Tell me why is it like this? Why do you think it is like this? You know, because there is a clear favorite emotion here of cansado. So let me know, why are you cansado? Why do you think the whole group is cansado? What is the problem? I mean, there is not a problem because all feelings are valid, but it's always interesting to identify why we are all here, because you cannot always be here in the green on the top, you know. They all one emotion can only exist thanks to the other ones. but it's good to recognize why it is like this. And if everybody is cansado, it's not a good thing if you're all the time cansado, because that's not cool. It's too much, you know. So then we have to see what can be done about that. Okay. Okay. Yeah, I'm gonna read the chat later. Why am I doing this, guys? I'm doing this because I am taking a diplomado in the tech about inteligencia emocional, and what yeah, I'm doing that because yeah, I have to do it as a homework, and then also try for the diplomado. And then the idea is, of course, to yeah, to see what we can do about that, you know, as a teacher, you know, if there is something we could do. Okay. And then later maybe you could also give me some suggestions in order to improve this. So it's just to get a little bit of feedback about this. And I think it's a good thing. I really like that about tech, you know, the recognizing emotions. It can only be useful for us. Okay. So when we're done, guys, then we're going back to the course. What are we going to do is we're going to do quickly a small game to see if you understood the things that we have seen yesterday. Okay, so it's very simple, very short. In fact, it's just like 5-6 questions. So I'm going to select you how you appear on my screen. Let's play. Play. So Santiago, where is the urinary bladder?
At the bottom, like the big the one that the tubes lead to. Yes.
Okay.
Yeah, that one.
That's a good one. Gustavo, you're next. The urethra, where is that? So here you have to be careful. I know that you know it's the tubes, but you have to be very careful because a lot of students, they confuse urethra. They think it's this one or they think it's this one. So make sure that you know what's the difference between ureter and urethra. So which one is it? This one?
The urethra is the tube below the bladder.
So this is the urethra or this one? One or two?
The one below the bladder.
Below the bladder.
One as well.
Okay, this one. You're correct. The urethra is what connects the bladder to the vagina or the penis. So who has the longest urethra, girls or boys?
Boys.
Yeah, boys, because the urethra goes through the whole penis. Kidney, Luis, where's the kidney?
They are these ones.
Very good, Luis. Exactly. Well done. And then we go to Carlos Trevino. Where's the urethra?
The what, teacher?
Ureter. So what you see here, where's the ureter?
I don't know how can I say it, but the lines that form the kidney to the urethra.
That's perfect.
That lines.
That's exactly what it is. Okay. So you all got that. That's perfect. Okay. So let's go back to our presentation to continue with the course. Okay. What we're going to do in a little moment, I'm going to do it a little bit more in the end. is we're going to talk about this hormonal system, okay? This hormonal system is very, very, very complex, guys. That's why you don't have to know everything, okay? I'm going to show you because basically what I would like you to know about, can you see it on my screen now?
Yes.
Okay, yeah, I
Yeah,
removed
yes,
it real quickly.
yes.
So this hormonal system, it's called the renin-angiotensin-aldosterone system. These are all hormones that are involved in the regulation of water, salts, and blood pressure. Okay, what is very complex about it is that the liver is involved because it's producing a hormone that is converted into another hormone that has an effect on the kidney, and then it's its turn, this angiotensin will activate another hormone, which is aldosterone in the kidney, okay? Also, the lungs are a little bit involved. And there is like negative and positive feedback loops. So positive is when one activates another one. That's a positive feedback loop, okay? So if we look at angiotensin, if this is produced, then you see that sympathetic activity goes up. You see that there is reabsorption of a lot of kind of ions, okay, and water retention. You see that aldosterone is released. You see also vasoconstriction, so that has to do with blood pressure, and it has an effect on our hypothalamus, okay? Our hypophysis, this is the hypophysis, in fact, or the pituitary gland, will produce ADH. ADH is very important because this is called antidiuretic hormone. Antidiuretic means that diuretic means that it's going to release water. Antidiuretic is basically a hormone that assures the reabsorption of water, and that's what happens in the collecting duct. Okay, you don't have to know all the details. You just have to know that there's more organs involved, and you have to know that like the loop is caused by renin. So you have, that's why it's called renin angiotensin aldosterone system. So basically what happens is that if there is a little decrease in perfusion, so let's say there is less blood passing through the kidney, so there is less filtration happening. So what happens if there is less filtration happening? Well, the kidney will produce renin. Renin will have an effect on the liver. The liver will produce angiotensin. So when there's less perfusion happening, it means that there is less liquid in the body present, okay? Keep that in mind. So the liver angiotensin will convert it in angiotensin 1, then in angiotensin 2, and then you see what happens, okay? It will, this is maybe the most important one, that antidiuretic hormone will be secreted, which is assuring water reabsorption. So more water will stay in the body, okay? Whenever there is more water in the body and the kidney doesn't need to retain as much water, of course, the release of renin is diminished. So this is all different kind of loops. This is just one loop, but there is many kind of loops that work like that, okay? Then we go to the second part. So this is a little bit the water absorption loop, but there is another important one, which is vasoconstriction and blood pressure regulation, okay? So our hypothalamus has a pituitary gland. Don't worry too much if you don't understand, okay? We're going to watch a video and we're going to see that more into detail in the endocrine system as well. But I just want you to know that, in fact, all the organs are interacting with each other if we're talking on a hormonal base. And what happens, in fact, is that our kidneys, they have a very important function in blood pressure regulation. Okay, why is that? That's very logical, because it's the kidney that can regulate the blood pressure, because it's the kidney that decides how much water is leaving from the body and how much water is staying in the body. Okay, the more water this stays in the body, the more water there will be in your blood, the higher the pressure will be of your blood. Okay, so the kidney is able to lower your blood pressure by removing water from your bloodstream, basically. Okay, and this doesn't only work with water, it has to do with ions, which is also the passive diffusion. Okay, and not only that, there is a water regulation that affects the blood pressure, but there is also hormones that control the smooth muscles around your arteries. and this is what we call constriction or relaxation, okay? So our hypothalamus, you see that it also reacts to the angiotensin, which is, its origin is from the liver, and the liver produces it thanks to a hormone released by the kidney, and it's going to the pituitary gland or the hypophysis is going to produce a hormone which is called vasopressin. It says it, the pressure of the vases, okay? Vasopressin is it's gonna constrict. So whenever it's gonna constrict, what happens is that if this hormone is released, then you get constriction of blood vessels. What happens, Cecia, if the blood vessels constrict? So the the diameter of the tubes becomes smaller. So what would that mean?
Sorry, what was the question, teacher?
So if our blood vessels, they constrict, okay, they go from this diameter to a smaller diameter, what happens with the blood pressure?
It goes
It
down.
Yeah, it goes up. Definitely goes up. It's the same thing as putting your thumb on a water hose. Okay. When the blood pressure goes up, there is another thing. Okay. When the pressure is higher in the blood vessels, there is more reabsorption of fluids. Okay. Because more fluid is pressed through the kidney, so more will be absorbed. Okay. And this increases the pressure. Okay. And if you want to regulate the pressure, you can if you want to decrease the pressure, the opposite will happen. So let's
have a question.
Quickly. Yes, Santiago?
You said that the kidney received more liquid the higher the pressure was, but
no,
wouldn't
it filters more blood.
It filters more.
Yeah. So think about it. It's the glomerulus. The pressure of the blood is higher, so more liquid will pass into the capsule of Bowman. So what happens as a consequence, if more liquid passes, then more will need to be reabsorbed into the loop of Henle. Okay?
Okay.
Because there's higher pressure. Okay, let's watch a small video about this. Should have it somewhere. A ver, ¿dónde está?
The renin-angiotensin-aldosterone system, RAS, is a hormonal system that controls blood pressure. While baroreflex is a short-term response to sudden changes in blood pressure, RAS is responsible for long-term regulation. In the kidneys, within the walls of afferent arterioles, there are specialized cells producing prorenin called juxtaglomerular cells. Upon activation by a drop in blood pressure, prorenin is cleaved to form renin, which is released into the blood. Renin converts a plasma protein called angiotensinogen, produced by the liver, into angiotensin 1, a peptide of 10 amino acids. Angiotensin 1 is further converted into angiotensin 2, an 8 amino acid peptide, by the angiotensin converting enzyme, ACE, predominantly present in the lungs and kidneys. Angiotensin 2 is a hormone. It binds to angiotensin 2 receptors in tissues to exert various effects. It stimulates vasoconstriction in systemic arterioles. It promotes sodium reabsorption in proximal convoluted tubules of the kidneys. It induces the release of aldosterone from the adrenal cortex. Aldosterone promotes sodium and water retention in the kidneys. In the central nervous system, angiotensin 2 has several effects. It acts on the hypothalamus to stimulate thirst and encourage water intake. It induces the posterior pituitary to release antidiuretic hormone, which promotes water retention by the kidneys. It reduces the sensitivity of baroreceptor response to increased blood pressure, so that this response would not counteract the effect of RAS. All these actions lead to an increase in blood volume and blood pressure. Angiotensin 2 is short-lived with a half-life of 1 to 2 minutes. it is degraded into angiotensin 3 and 4, which have lesser effects. Overactive or inappropriately activated RAS is a cause for hypertension. RAS is a frequent target of antihypertensive drugs. ACE inhibitors and angiotensin receptor blockers are common treatment for hypertension.
You are muted, teacher.
Every day. Don't worry if you don't understand the details. It's not the goal that you can tell me the whole loop and everything, how it works. You just have to know how the involvement is of the things, okay? Yeah. There's another video happening. Okay, we don't want that. Yes, Emilio?
So Mr. So we can reduce our blood pressure. We need to produce angiotensin too, right? Or no?
Yeah, in order to increase blood pressure, you have this angiotensin system, okay? So whenever a renin is produced, you automatically will raise blood pressure, okay? To lower blood pressure, just there's less renin and less angiotensin produced. So the less you have of this, the lower the blood pressure goes, okay? However, it's a little bit more complex than that because we also have hormones that are able to lower the blood pressure, but we will see that in the endocrine system. I just want you to, the objective of showing you this is just that you are in contact a little bit with certain hormones, and they will come back in the endocrine system. We will talk a little bit more about it in the endocrine system, but also don't worry about the endocrine system. You just have to recognize the hormones and you have to know more or less what they do. You don't have to explain how they do it, because that's really for when you want to go study medicine, you know? Okay.
Okay.
Okay, so so antidiuretic hormone and aldosterone, they both are involved in the raising the blood pressure. How that exactly happens, you don't have to know that, but you have to know what they do, where they're released, and what the function is, okay? Let's have a look at the bladder. Our bladder, depends on the person, is about 500 milliliters. If it's expanded, it could be even well a liter, you know. And basically what we have two sphincters, okay? We have this sphincter, the internal sphincter, and out the external sphincter, okay? You can see that right here. And it's basically these sphincters that give you, that is causing the uncomfortable feeling when you want to urinate, okay? So when you feel the pressure, there's receptors triggered in these sphincters, and then it's sending a signal to the brain, go to the bathroom or to the restroom because you need to urinate, and then you urinate, okay? These sphincters, they're also sometimes activated by other kinds of pressures, you know, if you're pregnant or you push on your belly, or sometimes because of a certain infection, a bacterial infection of the urinary ways, this bacteria or this pressure can also give the same trigger. So you might have the impression that you have to urinate, but it's not true, okay? So that's I have here like a more visual picture. If you're too shocked or you don't want to like to see blood, don't look at it. It's just the bladder, you know. That's if you operate, that's how a bladder looks like, okay? Where is it located? It's just behind the pubic zone. It can expand. It has like membranes around it. The good thing is that basically the urine in the bladder is sterile, okay? There is no bacteria in it, okay? If you get some kind of infection, the infection can go up till here, and it might be very, very painful. If you get like a urinary bladder infection, whenever you pee, it feels like a very burning feeling when you urinate. So then you have to take antibiotics in order to get rid of that. It's very curable. It's especially girls that get this kind of infections because of the nature of their genitals. So you have to be careful with that, okay? So we already talked about the next thing. You know, urine is basically made out of uric acid and urea, okay? There's 2% of urea, and for the rest, it's basically all kinds of ions and salts, and it's a lot of water. And this is very important, guys, because like I told you yesterday, you have to look at the color of your urine. And like I said, it should be very slightly yellow to even white. That should be a normal amount. And you urinate what you drink. So if you have to drink 1.5 liter of water a day, you should urinate more or less 1.5 liter of water a day as well. Okay. So this is how that looks like in a girl, you know, the female and the male urethra. So here you have the pubic bone, you have here the bladder, here you have the uterus, okay? This is the vagina here on the bottom. And then here you have basically the rectum. This is another picture. How would we call this cut, guys? This section, how do we call that? Imagine this.
Sagittal.
Yeah, it's a sagittal one. I have another explicit photo, but it's part of biology. This is the vagina, the vulva of female urinary system. You also have here a school book picture of a vagina. And it's interesting to see that. I think it's important to notice this next thing. Why do girls get more often urinary infections? It's because the anus is very closely located to the vagina, okay? And another important thing to notice is you have the vagina is between the anus and the urethral orifice, okay? Sometimes I got questions in the reproductive system, if you have sexual intercourse with somebody, is there any risk that you go there is confusion between the two holes in the vagina? No, there is not, because the vagina it can expand like the size of a baby head. You know, it's very flexible opening here, and the urethral orifice, it's impossible to put something in there. It's really not possible. If there is like a sonda or something that has to be put in to check out something, it's even very, very painful. So normally there cannot be any doubt. Okay. Yeah, that's basically it. So we will look at the vagina into more detail when we go to the reproductive system. But basically, what is interesting to know as well is that the vagina has some protection. It's always humid on the inside, acidic, in order to get rid of infections. And we have the labia minora, which you can see right here. This is the labia minora. You see this pinkish thing, that's the minora. And then the labio majora, which is basically just human skin. Okay, this one, there is no hair, but usually there should also be pubic hair in order to keep it clean and to protect these openings. Okay. Then let's have a look at the male system. Okay, so like I said, the male urethra, you can see that here the female is only 5 centimeters long. If you look to the male one, it's 12 to 15 centimeters long, depending on the size of the penis. And that's the very same reason why males, they don't have so often problems with urinary infections, because basically this is on the outside, and it's quite hard for bacteria to travel all the way up. Moreover, males basically, there is always some urine in the penis and in the urethra, and there is like a production of a liquid. So there's always like very slowly liquid passing. So basically it becomes very difficult for bacteria to climb up, because there is all the time this little flux down. Okay, so it gets really difficult for bacteria to give an infection to men because of the distance to the bladder. Okay, this is like the male. This is like a penis. This is not a normal penis, guys. It's a penis in erection, and it has a circumcision scar line. I think some of you might have had circumcision. This is done when the skin is removed, because normally the top has some skin over it. Here it's removed. They do that. It's a practice for Jews very often. There it's obligated. But I noticed that in Mexico there has also been some how to say it, fashion, or not. Yeah, I don't want to call it fashion. It's been in, yeah, how to say it. I've been noticing that a lot of people, they do that because other ones do it. So in Europe it's not done, but I noticed that a lot of people in Mexico, they choose to do a circumcision for I don't know what kind of reason. Yes, I agree. It's more hygienic. That's without any doubt. But of course, you can also clean it. But you have. I wouldn't do it if I was your parent, because I mean, if you're not a Jew, basically the skin is there for a reason as well. It's to protect it. And if you do a circumcision, you will lose a lot of sensitivity in the glands of the penis. So it might not be that fun on a later age. Okay. So here you can see that on the schematical picture, you see here the urethra, here you see the bladder and the ureters. Yeah, the testicles and stuff we will talk about in the reproductive system as well. Okay, so diuresis is the amount of urine that we produce. It's about 1.5 to 2.5 liters a day. And there are substances that promote diuresis. You all know that if you drink a lot of coffee or a lot of alcohol, this increases diuresis. Okay, there is foods that make you urinate more. This we call diuretic products. Okay, some examples are coffee, beer, even watermelon juice is very diuretic. Also, jugo de Jamaica, agua de Jamaica is also very diuretic. It makes you urinate more. Also, camilla tea, you know how you call that in Spanish? Camilla, it's chamomile tea, or I don't know. Yeah, this yellow flower, also diuretic. Okay. This section, guys, how do we call this section? Because this is another cut. How does the urinary system look like? You have here the kidneys, you have the ureter, the bladder, the urethra. How do we call this? Is it sagittal?
Do you mean like the sagittal and transverse and things like that?
No, transversal is not. It's the other one. It's a coronal.
It's a front.
No, I'm just wondering if you were asking that, like the question, if we had to.
Yeah, no, just if you notice, it's a coronal cut. Okay. Okay, we already have talked a little bit about the pathologies. So you have this urinary tract infection. Here you can typically see what it's caused. You know, like I said, you have the anus in girls, which is very close to the vagina. And basically there might be bacteria that go from the anus to the vagina, and then you can have this urinary tract infection. That's why if you go to the bathroom to do number 2, girls, they should always clean from the front to the back and never from the back to the front, because then if you wipe yourself, then you bring the bacteria to the front. So basically you have to clean yourself like this. Alec, you go up, you don't go like this, because then you're going to pull the bacteria to the front. It's not a good idea. It might cause this urinary tract infection. It's not too bad, guys. You can really fix that quite easily with some antibiotics, but it's uncomfortable because it gives a burning feeling. It causes redness. It might even, in some severe cases, there might be some blood in the urine, but it's not that common. Then we have a phenomenon which we call hydronephrosis, which is basically a problem of the kidney that the liquid, the urine doesn't lower to the bladder, and it accumulates in the kidney. And that's really bad, because in fact you get a high pressure of urine in the kidney, and this could be caused because of different problems. It could be that something is blocked. It could be a severe infection. These kind of things, they can cause that the urine stays in the kidney and it damages the tissue. Okay, we call that hydronephrosis. A very, very dangerous. Okay, caused by tumors, scarring of the tissue, even pregnancy. But very often it's just a kidney stone. Okay, and then it's fixable. Okay. Then there is another issue that we call renal failure. Renal failure is being caused by taking a lot of drugs very often, or sometimes as well by having too much salt, too much kidney stones. It's just that the organ itself, it starts to be destroyed, you know. Kidneys, they can, you could compare it a little bit with what we talked about with the liver, this cirrhosis and stuff, you know, that the liver gets scarred. This can also happen in the kidneys when you have an injury, you have too much salt, you have an infection, you have some kind of viruses, you have tumors. all of that can cause a renal failure, as well as taking excess of medicines, okay? If you take drugs or medicines or certain substances in high concentrations, sometimes the doctor tells you that it might be dangerous for the kidney. So be very careful here, because if you have these toxins accumulating in your kidney at a long term, it could cause this renal failure, okay? It's very serious, because if it's really, really bad, then you have to start thinking about the kidney transplant. Just read this, guys, streptomycin, ibuprofen. So don't think, why should I not take the 1 gram ibuprofen all the time? Well, it damages your kidney, okay? So be careful with medicines. Most people get kidney damage because they're addicted to pills. So you have to be very careful for that, okay? Kidney stones, we have talked about that already. It's a little bit the salt accumulation in the kidneys. That's a little bit the pathologies I wanted to talk about. Also, please always check Canvas as well. I mean, the information is the same, but we cannot do everything in the class. I prefer my own presentations, but as well in Canvas, you can find interesting information. So whenever you make your notes, I do recommend to check both sources a little bit, okay? Are there any questions for today? Because today we finish with the urinary system, so that tomorrow we can start with the introduction of the other system, which I think it's the nervous system, okay? And we have to do that because the nervous system is more complex than the urinary system. And basically, we need a little bit more time than 2 lessons for that, because next week, Thursday, remember, we have the module quiz, okay? So that's why we will organize it like this, that we have our 3 lessons for the nervous system, okay? Any questions?
No, mister.
Okay, perfect. Then for tomorrow, guys, what you need is you have to look for pointy scissors, and you have to look for a ruler, okay? Not too pointy that it hurts you, but make sure that you come to our class with pointy scissors, okay? It's to introduce the nervous system. So it would be nice if you have that. Everybody should have it. If you don't have it, you could take 2 pencils or something. It's an activity that we will do so that you can see for yourself how we are innervated. But you will see that tomorrow, okay? Okay, so take care. If there are no more questions, we see each other tomorrow, okay?
Thank you, teacher.
Right.
Bye, mister.
Thank you.
you.
Wednesday.
Bye.
Thank you, teacher.